Welcome to the influenza virus presentation. My name is Julia Lind and I'm going to be getting us started. The correct name for influenza is the influenza virus. There are three types: influenza virus type A, B, and C. They are all part of the Orthomyxoviridae family. The cell is covered in a lipoprotein envelope that is studded with glycoprotein spikes, which come during viral maturation. The cell envelope contains proteins that form a channel for ions into the virus. All types of the influenza virus are negative sense, single-stranded RNA genomes. The RNA has extreme variability and is subject to genetic changes. Humans are the reservoir for human influenza type A, and the avian reservoir is wild birds. Horses and pigs have also been found to carry it. Type A has human and animal reservoirs, whereas types B and C are almost exclusively found in humans and do not have animal reservoirs. We are all well aware of how the influenza virus is always changing season to season, and I want to talk about how that happens. Pigs are able to be infected with more than one influenza virus at a time. Let's say they have a human influenza virus and are then infected with an avian influenza virus. The genes of these viruses can mix and create a new virus. It is similar to the previous strain of influenza, but is still not recognizable by the human immune system and will still infect us. This change in the virus is called antigenic shift.
Hi, my name is Chance Buck, and I'll first be talking to you about how influenza is transmitted. Okay, here we go. The flu virus is often spread through direct contact. This could be through touching or kissing, but most experts think that flu virus is spread mainly through tiny droplets made when people with the flu cough, sneeze, or talk. These droplets can land in the mouths or noses of people who are nearby or be inhaled into the lungs. It's said that people with the flu can spread it to others up to about 6 feet away. People can also be exposed to influenza indirectly. This happens when you touch a surface or object that has the flu virus on it, and then you touch your mouth, eyes, or possibly your nose. These non-living objects that harbor and transmit pathogens are called fomites. Some examples could be a phone, as you see in the slide, doorknobs, or faucet handles. Studies have shown that human flu virus can survive on surfaces between 2 and 8 hours. You may be able to pass the flu on to someone else before you even know you're sick. Most healthy adults may be able to infect others beginning 1 day before symptoms develop and up to 5 to 7 days after becoming sick. Young children can be contagious for an even longer time. Some people can be infected with the flu virus but have no symptoms, but during that time, they may still spread the virus to others. A quick personal story. I substitute teach at local schools, and this February everyone was getting sick. I started feeling sick on a Monday, and by Thursday my wife was really sick. I assumed I had passed it on to her, and so in the meantime we may have kissed once or twice, and by the beginning of the next week I was sick again, and I'll go ahead and finish that story later at the end of our next slide, which is the incubation period. The incubation period for influenza is 1 to 4 days. This meaning symptoms will start to appear 1 to 4 days after the virus enters the body. There are no distinctive unique signs that we can see from the outside that make influenza easy to diagnose. So people who have the flu often feel some or all of these symptoms: fever or feverish feeling, chills, muscle or body aches, cough, sore throat, runny or stuffy nose, headaches, and fatigue. Some people may have vomiting and diarrhea, although that is more common in children. So, how do you know if you have the flu or just a cold? These symptoms usually come on suddenly and are worse than those of the common cold, and colds rarely cause a fever or headaches. The stomach flu we often refer to when one has an upset stomach isn't really the flu at all, but gastroenteritis. These symptoms can range from mild to severe. Serious outcomes can result in hospitalization, and at times can even lead to death. Some people may develop complications as a result of the flu, which may include pneumonia, ear infections, sinus infections, dehydration, and worsening of chronic medical conditions such as congestive heart failure, asthma, or diabetes. So, to finish my story, the first time I got sick, I believe I had a mild case of influenza, but my wife's case was a little more intense, and then it really hit me the second time. I had a sudden onset of chills and fever. I would wake up drenched in sweat. I had full body aches and pains and a sore throat. I was stuck in bed and could hardly do anything. After days of this and my throat was getting worse, I could barely drink any water. I went to the doctor and discovered that my sore throat was actually strep throat. It was the most miserable sick I had ever been. My sister-in-law's uncle caught the flu this winter as well. His condition kept getting worse, and he ended up developing pneumonia, which hospitalized him. He was on a breathing apparatus for a couple days until, unfortunately, he passed away. The flu isn't something to take light, and we should definitely take precautions against it.
Hi, my name is Zach Lovell. I will be going over treatment, prevention and control, and additional information. Alright, treatment of influenza, which is otherwise known as the flu. Many people can overcome the flu on their own with bed rest and drinking lots of fluids. However, if this doesn't work, then there are antiviral drugs available. If you choose to wait and see if you can overcome it on your own, but symptoms don't start improving after about 2 to 3 days, then it is best to go and see your doctor. There are 3 antiviral drugs that are most commonly used. They are Tamiflu, Orlenza, and Peramivir. Taking these antiviral drugs can decrease the time you are sick by about 1 to 2 days. It is best to take them as soon as you can after the symptoms have presented, but they can still be helpful if taken later as well. A doctor can prescribe these drugs to anyone, but they are a must for people who have been hospitalized due to the seriousness of their flu. Also, people with high-risk health issues, for example heart problems or respiratory issues, should be taking these drugs right away to help prevent any further complications that could potentially be caused due to the flu. Preventing the flu. The best way to prevent the flu is by getting the flu shot. There are multiple vaccines for the flu depending on the strain, and it is recommended that anyone over the age of 6 months get an annual flu shot. How the vaccine works is about 2 weeks after receiving the vaccine, your body will start creating antibodies that will help fight the flu if you are exposed to it later and prevent you from even getting it when you are exposed to the actual virus. If you don't like needles and are wondering if there is a different way, there is a nasal spray as well that can be taken. This nasal spray only needs to be taken once annually, just like the flu shot. However, the nasal spray does have side effects such as headache, runny nose, cough, or sore throat, as opposed to the needle, where the side effects are soreness at the injection site, low-grade fever, and some aches. In controlling the spread of influenza, the best way to control it is by proper hand washing and covering your mouth when you cough or sneeze. The best way to do this is with your elbow and not your hands. We touch many things during the day that others touch as well, and we shake other people's hands, so we want to keep our hands as clean as possible because that is an easy way to spread the infection. If you are sick, it is best to avoid crowds. It is recommended to stay away from others until about 24 hours after your fever has gone away or after you have started medication. This makes it less likely for you to spread the infection to others. Some additional information about the flu. Each flu vaccine protects against 3 to 4 different strains of the flu, and the vaccine can be changed each year to better protect against the strains that are expected to be around that particular year. The mortality rate for the flu is about 1.2 deaths per 100,000 people. This infection is definitely treatable, but it can be deadly if it isn't handled in the appropriate manner, so don't take it lightly. A common misconception is that the flu shot can and will give you the flu. This is not true. The virus that is contained in the vaccine is inactivated, and because of this, it cannot cause infection. It simply helps your body create the antibodies it needs to fight the infection if it does come around. The flu season in the United States is from about November to March, so make sure you get your flu shots before the flu season starts to get a jump on it. Remember, it takes your body about 2 weeks to create the antibodies it needs to fight the flu after receiving the vaccine. That is it for our presentation, and thank you for listening.